Good evening, guys. This is Dee. I guess it's not evening as much as it is early morning, but I'm just staying up super late, that's all. I am making a video here that it's an important one. It's for nursing, so it's not a fun one. It is a serious one, but it's fun for me, and it's probably fun for other nurses, but otherwise it's probably not fun for you. But if you want to watch, you're more than welcome to watch. But yeah, so this one's about a nursing topic. It's about nursing interviews. So this is for new nurses or nurses who are returning to the field and returning into clinical practice that haven't been there for a while and are interviewing. So this is a video about the types of questions to expect during a nursing interview, how they're usually structured and laid out, and a little bit of information as to how to answer those questions and how to navigate through them. So I have this experience with, well, of course, because I've been through my own nursing interviews. My first most difficult one was my eMERGE interview, which I'll talk a little bit about today, but I've also interviewed new nurses that were to be hired as well. So I've been on both sides of the fence on this one. So I've got some good, well-rounded information here to share. So again, it's for nurses, but anyone else who's interested, go for it, watch it. So first of all, nursing questions, like a lot of interviews you'll go to that aren't nursing are just specifically, they're not so much an interview based on the skill or the job, but based on EQ as opposed to IQ. So like emotional quotient questions. So they're more totally behavioral based. Now, we do have behavioral based questions in nursing interviews. I've asked them myself, and I've answered quite a few of them myself as well. But we do also have specific and like knowledge questions too. So, and competency questions. So those are the ones that you're going to want to focus on, because I think you probably already have the behaviors figured out if you made it through nursing school and made it through the CRNE or the NCLEX already. So, or any other nursing board certified exam that you go through, as it is a licensed, like a licensed body, right? So there's that. The common types of questions you're going to get are, so they're going to be, first of all, you'll get your behavioral based questions, and I'll talk about those. But you're also going to get, and I made some notes here because there's a lot of information. So you'll get questions about teamwork. That's a huge topic in nursing. It's very, very important. And that's one that this is going to be focused on. You'll get questions about patient care. So those are more clinically based questions. Adaptability, and that's going to be sort of behavioral as well. But it's behavioral and clinical sort of mixed together. So there's that. It's talking about transitional skills and transitional practices and behaviors, I suppose, from one section or area of nursing to another, or as a student into a new nurse. So it's how you take what you've learned and transition it into what you need to know now. So, and going forward, you're going to have a lot of questions about time management, because that is like one of the top 3 things that you've got to be sharp and be excellent at as a nurse. Communication style, which is super duper important if you want to do well and you want to be one of the nurses that families are happy to see that they have working with them that evening or on that shift. Then your communication style is going to be like super important, and it's something you're going to want to master and be really self-aware about and on top of. So there'll be motivation, core value questions, and then of course there's questions that you're going to want to make sure that you have for your employer as well, because that shows that you're engaged, you're interested, and that you're acknowledging that you don't know everything, and that you do have standards and beliefs and values and morals, and you want to know if the agency is a good fit for you as well, not just whether you're a good fit for them. So that's a responsible thing to do, is to ask questions to ensure those things are a good match, right? So So let's talk about behavioral questions first. So usually, and you'll have gone through this sort of thing in sort of in nursing planning, in care planning, and that sort of thing. But it's not called this. It's called, so in interviewing, it's called STAR method, and it's basically, it's going to be identifying the situation, the task that's at hand, like what you need to do to deal and address this situation, the action that you take exactly, and then the results. So it's sort of like, like identifying the problem, investigating or assessing, like identification of an issue, providing a full assessment, or vice versa, and then developing a plan of care, providing that care, and then documenting the outcome. So same sort of thing. It's just, this is interview style nursing care planning. So I mean, you could use a million examples for what's for coming up with a situation, any situation at all, and what you need to do to address this situation safely and effectively and efficiently. You want to document what you did and the action that was taken, and also document the results and the outcome as well. So that's the STAR method, and that's the STAR method of behavioral based questions. You want to make your answers concise and fully explain your nursing process. So when you come to the portion where you're talking about the situation, the task, and the action taken, the task and the action taken are going to be your most important things to discuss here. The outcome is going to be obvious, and the situation is going to be obvious because it's going to be one that's asked of you. So you don't really need to go into much of that. Unless you have to come up with one. But then again, that's just identifying, pulling a situation out of your experience, from any job, anywhere, and then discussing what the task was, the action taken. This can apply to anything, and this is what I mean by transferable skills. Like, you could run into a situation like this working at the mall, or like something that follows this pathway. You could, or as like a clinical extern, or as a clinical student. So there's lots of experience that you have that you can apply and use the STAR method when answering behavioral based questions. So don't forget that. That's really important. It helps to clarify, organize, and strategize your answers. So whoever's interviewing you gets a good idea of your process, and that's the most important thing. I mean, we've talked about the common types of questions. You're going to get questions. You're going to get questions. These are the ones that I hate. Oh my God, because you blank on them. So always be prepared for these. Have a few situations in mind. Describe a situation or a time when, right? You're going to get those. So let's say an example is describe a situation when you worked with a difficult coworker, when you had to build a relationship with this person. How did you go about doing that, and what exactly did you do, and what was the outcome? Basic interview question. Because you are going to work with difficult nurses. There's a phrase about nurses eating their young, and it's true. It's true. So I know it sounds terrible, but that's how it does feel sometimes. But I mean, there's amazing nurses and there's not amazing nurses, and just because they're not nice to other nurses doesn't mean they're not fantastic at their job. So it's just people are different, and you got to learn to mesh with all types. So anyways, a situation like that, how you would answer a question like that, first and foremost, I would advise you never, ever, 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 ever say anything bad about a previous coworker or manager, because that's a transferable behavior that an employer is going to see as something that you're prone to doing, and as a behavioral marker, as opposed to a one-time situation. Even if it was a one-time thing, avoid that altogether. Leave that out. Leave that part of it out, criticizing somebody else. Never talk badly about anybody in an interview. Explain why a nurse was difficult. I would explain why that nurse was so difficult, and give examples that back up, and so it's giving evidence, providing evidence to why the nurse was difficult, what made this nurse so difficult, and what made it a challenge for you, and then how you planned to address this issue and to develop a relationship with this difficult nurse, and what you did about that, and the outcome, whether it worked or whether it didn't. And I don't think the outcome is as important as the fact that you recognized that there was a problem, you identified it, you thought about it, you came up with a plan of action, and you followed through. All of those things are going to be way more important than whether at the end of the day you had a good relationship with that nurse or the nurse still hated you like she hates everybody else. Right? So this interview is your time to shine. It's all about what you would do, not about what other people do. So don't worry about the outcomes of other people. Worry about showing your best self. And you're obviously excellent at critical thinking, or you wouldn't have made it through school. You wouldn't be in a position for an interview, and you're qualified, or you wouldn't be here either, because not many unqualified nurses make it through and make it past the NCLEX or the CRNE. I'm just saying, those are awful exams. Been there. So what else? You want to turn negative things into a positive. So if you if something, you had a negative experience and you're asked about it, explain a negative experience, I would describe why it was negative, describe why that was such a trigger or a challenge for you, or why it was so difficult for you, and then I would turn that around to what strengths that helped you to develop, what challenges that helped you learn to overcome, and things like that. So and I mean, they expect that. They know that's a lot of BS, but it also shows that you're able to pull the good out of every bad situation. And in nursing, sometimes you got to be able to dig to find the good, because there's so much challenge and so much difficult, and there's so much to carry in on our shoulders emotionally and just responsibility wise, that we have to be able to find the light, even if it's like way far away. You know what I mean? Like, we have to be able to identify positives in situations that seem like there are no positives. So that's an important one. That's what's going to keep, that's going to develop into nurse retention. Nurses that can hold out and stay in a position, stay in a role, and they're not going to be replacing you in 3 months because you just can't handle it. So that's an important one. Communication wise, I would avoid using any medical jargon. It doesn't make you look smart. It does the opposite effect, I believe. I think it's best to dumb down your language, not even dumb it down, simplify it, and use everyday common grammar and common words to help explain, because you want to demonstrate that you're able to do that with family. And that's a skill, that's a talent that not everybody has. And that's part of your bedside manner and part of good communication. The fact that you can describe something to family on their level, that makes you an adaptable nurse, not nurse practitioner, but a practicing nurse. That makes you adaptable, and it means that you can walk into one room with a certain culture and you can deliver a message, but you can also walk into the room of another complete culture where they have different expectations of communication, and you can transition and deliver information to them in a way that's most relevant to them. So that is super important. What did I have for a question for that? I'm trying to think, because it was a good one. I knew the answer, but it still had me shaken. I had a few of them. Oh, okay. I had, that's what they are. I had two. One was, your patients had a heart attack and you're working in Emerge. How do you describe to a family what a heart attack is? So my answer was, I would describe to the family that a heart attack means they've had a blockage in one of their 2 coronary arteries, and that blockage, one or both actually, it could be both, that blockage has caused a restriction in blood flow to part of the heart. And without blood, there's no oxygen, so that part of the heart starts to die, right? That heart has cell damage, cardiac cell damage. So that is an easy, straightforward way to explain. I was asked to explain what it means that when my patient has had a stroke to family. And I've said there's to family, I would say there's two types of stroke. There's the bleeding kind, that is what we call a hemorrhagic stroke. And then there's the clotting kind, and that's what we call an ischemic stroke. And that just means there's something blocking oxygen, again, blood flow and oxygen to the parts of the brain. And the bleeding kind leaves permanent disability. Wherever the blood touches often deteriorates and has damage from it. And an ischemic stroke, there is a better chance of having a more full recovery, because there are types of occupational therapy, physiotherapy, things like that, that can help to improve your the damage that's been done by the ischemic stroke and the lack of oxygen. You can't go back and correct and fix those heart cells. Whatever's altered is going to be altered, but you can go back and maximize the ones you have and live a healthier lifestyle and get more out of what you've got. So you can add positive into negative while you're explaining. And that's usually those are good messages to give family, because it kind of puts them at ease a bit. What else is there? That's about it, I think. So I guess the big take homes here are to focus on that STAR method in answering questions, which is the describing the situation, describing the task, what you need to do to resolve this situation, the action that you take, and then the result, and documenting everything very well in that order. Also, another takeaway is to remember what types of questions are going to be asked. And a lot of questions are going to be asked for you to describe things. And I've used these when I interview nurses as well, to describe things in layman's terms, in terms that everybody can understand, because confusing families with fancy medical terms just makes it worse for them. It makes it scarier. It makes it more, it just makes it everything more intimidating and scary when they can't understand. And not understanding is the worst thing you can do to a family, is to go in, explain to them, and leave them more confused than you found them. So there's enough people in healthcare that can do that. It's up to us nurses to get the point across in a manner that they do understand, so that they can appropriately make plans as well. So whether that be housing, or whether someone's going to need supports after they leave the hospital, or what are their chances of surviving, and do we have to face a potential negative outcome here, things like that. It's best to be honest about those things, and I would make sure you're clear about that in interview, and just really make sure you're describing your own nursing process, because by the time you've graduated and you're a nurse, you have 4 years of education and practice and clinicals, you have a nursing process, even if you don't know you have one yet. It might change when you go into your new work environment eventually, because you're going to hone down and niche down to certain skills, and depending on what department you work in, but you will always have your own nursing process. So that's what you want to describe, and that's what you want to convey. And you want to convey that anything that you've learned up till now is transferable to this new area, and give examples as to why each skill is transferable, what you foresee as new needs and new learning that you're going to have to do, and explain how you're going to go about doing those things and learning these things. Developing good plans of care for both patients and for learning for ourselves does show that we're motivated and we're committed and we're engaged, and that we do love what we do, and that we are willing to invest in ourselves to make ourselves the very best healthcare practitioners that we can be. So that is all I have to say, and I'm sorry if this seems long and drawn out. There's a lot of information here. If you have any questions, please write them in the comment box. I'll answer. Like I said, I do have quite a bit of experience with interviews, so if you have any specific questions, go for it and ask me. I've been interviewed for many jobs. Like I have quite a varied background in nursing. I've done a lot of different things, so I have a lot of experience with different types of interviews, and in my roles, I've interviewed a lot of nurses as well. So it's not something that is just textbook knowledge to me. It's something that I've lived and I understand quite well. So do leave questions and comments if you feel it's necessary. And please, everybody, if you do like my videos and you find them valuable, do not forget to subscribe and like them. Thank you so much, guys, and I hope you have a great sleep. I should be sleeping too, but I'm not. I'm making videos instead. So I don't know if I'll be up at 4:30. We'll see. If I am, I'll probably make a video. So have a good night, guys. Take care.